Good afternoon. It's a Monday morning or Monday afternoon, I guess, and it's we're going to do this at 12:30 every Monday, and so this is week 2. We're still getting used to what we're doing here with Facebook Live and Instagram Live. I appreciate everybody for watching last week. We had, I think, over 2,000 people watch the video, so thank you for supporting it. And for those that came out and brought their pets in, thank you. We offer for new clients 25% off the next 2 months, January and February, and for pre-existing clients 10% off. So please tell your friends and family about that and take advantage of it while it's going on for these next 2 months. And also, I want to say thank you to everyone who's on Nextdoor. We were voted Best Vet in Spring Hill for the 2nd year in a row, so thank you for that. It's a very great honor that we all certainly are very thankful for. So today we have another Golden Retriever with us. So it's a little smaller version of Honey last week. This is called Hattie, and she's one of our staff's puppies, and she is a very sweet puppy. And how many weeks old is she? 9. Okay, so 9 weeks old, and growing very quickly because I've seen her the last few weeks and she's already sprouted. So Hattie is going to not get her anal sacs expressed today. Thank goodness for Hattie, right? But we're going to talk about it. So she's just here as our model to kind of talk with and make it a little bit more of a cuter video. So anal sacs, what are they? What do they mean? So let me have you kind of come in here, Jamie, and then, if you ever have had a pet, a dog especially, scooting across the floor, and for the first time that you see it, you're kind of like, my goodness, what are they doing? It's kind of funny. It kind of looks silly. They're probably trying to express their anal sacs. Or maybe you're sitting in a chair and you smell this awful smell. Sometimes that's not just gas. It could be actually a liquid, which sounds very terrible, but it is true. And dogs and cats have anal sacs. They have anal glands that they express. And so we're going to talk a little bit about what that means today and how it's done and all that kind of stuff. To start with, though, let's kind of look at where they're located in the body. They're located around the anus, which is where the name comes from. And so the anal sac is on each side, about the 5 and 7 o'clock positions if you were to look at the rectum as a clock face. And they are expressed kind of either one of two ways, either externally or internally, depending on who's doing it. Most groomers tend to do an external anal sac expression, although some do internal. And then all veterinarians do internal anal sac expressions, which are very thorough and tend to get the most out. And so what comes out is this bad stuff that is called malus liquidus, which is a liquid that's produced by the anal glands. It smells very bad. So I guess the question that a lot of people have is, why in the world do dogs and cats have these things? So the reason they have them is that when they were out in the wild and they were running from a predator, they have these things that stink very bad, like a skunk would have, and they spray them out and hit the predator in the face and then get away. So the good thing is that dogs usually are in the house. We feed them, we water them, we play with them. They never get scared. They have a really good life. And so so they end up really not having to express them very frequently on their own. But when they get full, they do want to do that, and that's why they scoot. If they do it outside, it's great. That's what you want them to do. Some dogs, especially the heavier dogs I see, have trouble expressing their anal sacs altogether. And unfortunately, anal sacs that aren't expressed frequently become impacted and maybe even infected. And when they do that, then we have problems, and then we need solutions to the problem. Sometimes if we go in and we're trying to express the anal sacs, we have to really work hard at it. More of this, the more we do of that, can cause scarring. Infection can cause scarring. And so I tell everybody, we want to try to do it as minimal as possible. So people ask about frequency. How often should we do this? I recommend as minimal as possible. But if they're coming in for a groom, it's probably a good time to do it. If they're coming in for a yearly checkup and you want it done, it's probably a good time to do it. So those are probably the best times to do it. And so, if we have to do antibiotics and anti-inflammatories for an anal sacculitis, which is an infection, a lot of times we do also recommend laser therapy, which I wanted to grab for you. And I'm sorry, Hattie. This little machine is really a good machine and a good tool, because we just kind of paint their back end as we do the procedure. It's not on right now, but we use this little laser to paint their back end, and that tends to warm the tissue, causing the tissue to go through its cell cycles, and helping just everything turn over, and less scarring. It kills bacteria. It does a lot of things that are very helpful for anal sacs, and so this is a nice tool to have in our regimen when we're trying to treat an anal sac infection. If anal sacs get real bad, a lot of people don't notice it. They may be busy, not noticing their pets, scooting, and if those things get big, they can pop, they can rupture, and it's actually probably a lot of relief for the pet, but it looks horrible for us because we see all the stuff coming out, usually blood and pus and things that most people don't like to see. But those are easily treated too. We can do pretty much the same thing as what I've just discussed prior to that. So hopefully we'll catch it before then, and hopefully this video will help you catch that before then. As far as cats go, cats don't tend to get as many anal sac troubles as dogs, so we don't see it and don't tend to express cats as frequently. But it's something we do fairly frequently with our dogs. So anyway, I hope you like this video. It's just a short little segment about anal sacs. And if you have any questions, please leave those questions in the little comment section. If you have other suggestions for other videos, we would love to have those as well. And we certainly like all the good feedback, all the positive feedback. So feel free to do that. Come visit us. If you can't do the anal sacs on your own, you need some help, we'll be happy to help you with that. So come see us. We'll be back next week, and we'll talk about vaccinations and a little bit about the new technology that we have that's even beyond human technology. Thank you.